What's going on, guys? Tony Maritato here. So it is the end of 2022. We're getting ready to start 2023, and we need to talk about deductibles. There are lots of questions from PTs, OTs, and SLPs floating around the Facebook groups asking what is the best way to handle Medicare deductible, secondary deductible, and of course, Medicare Advantage and non-Medicare. So let's talk about it. There are a couple strategies. The strategy that I use, now I have an administrative team. I'm not the only owner-operator. We have the infrastructure to do this. We will call on the questionable plans. So we know that Medicare has a deductible. We know that many of the supplemental plans will pick up the Medicare deductible. We've been doing this long enough. We've been in practice since 2002 that we can pretty much eliminate all of the plans in which we know the secondary will pay the Medicare deductible. But if you don't know, the best practice is to call the Medicare secondaries, the supplemental plans, and ask if they covered the deductible. There's also a chart that Medicare publishes for the supplemental policies based on the letter, so supplemental plan F or plan G, that shows you if that plan covers all or some of the Medicare deductible. It also shows you if that plan covers all or some of the 20% coinsurance. So you can eliminate a lot of the questions by doing the research, calling the supplemental plan directly, or referencing the chart. I'll post a link to that chart in the description of this video so you have it for reference. But non-Medicare plans, you also need to call those plans, determine if the plan deductible resets, determine if there are any other, secondary plans or anything that's going to cover the deductible. Now, for our Medicare beneficiaries, we have the capacity. Medicare allows you to hold claims up to 12 months. So if we have a Medicare beneficiary who believes that they should not owe their deductible, but we have information from the supplemental that suggests it will not cover the deductible, a lot of times what we'll do is we'll hold the Medicare claim. We will not submit it until that deductible has been met by another provider. I am not saying that's the best practice, but I'm saying that's an option that is available to reduce the confusion on the Medicare beneficiary's part and to ensure that you receive payment for your services. But if you are not able to hold those claims, allow it to get sorted out, the absolute best thing to do is call the insurance company, determine if the deductible will be owed, determine what the allowed amounts are if you don't already know that. And remember that even if your claim goes out with a bill rate of $350, the deductible is only credited with what the allowed amount is. So if I bill $350 for an arbitrary claim, the allowed amount is $127. The $127 is what will be applied to the deductible, and that is what the patient will owe us in payment at the time of service. Of course, be prepared that if you collect and for whatever reason the deductible was met somewhere else, you will have to issue that refund to the patient as soon as you receive confirmation in the form of an EOB stating that the deductible had been satisfied already. So I know it's a confusing time. I know it's frustrating. It increases the administrative burden. It increases the cost of delivering services. But I'll tell you that the better you figure this out now, it will help you into the future of running your business. So if you have specific questions about Medicare, non-Medicare, Medicare Advantage, post those questions in the comments under this video. And I wish you the best, because this is, a big responsibility. This is what we need to do. And the better we learn to manage the billing and collections, the more efficiently we can operate our company. Guys, I'll catch you on the next video.